Hey guys, this is with Nursing School Made Easy. Today's lecture is going to be on Cushing's syndrome. Now, I made this lecture before, but we're going to gear a little bit towards preparing you for your NCLEX exam. So I'm going to just hit you with the main points right away. Again, that way it's easier for you to remember and know for the NCLEX exam. So let's go back a little bit here and let's focus on a little bit of anatomy, a little bit of physiology. I think if you understand that, if you really know that portion, then Cushing syndrome is just going to be really, really easy for you to remember. So let's get started on this right away. There's going to be a head here, neck, shoulders, abdomen, and then I'm going to just draw pretend this is the heart, and then off the heart you're going to have your aorta, right? Then you're going to have your renal arteries, and you're going to have your kidneys. Now right on top of those kidneys, you're going to have your adrenal glands. Now they're not that big, I'm just, again, oversimplifying things. But these adrenal glands are going to produce hormones. They're going to produce steroids or corticosteroids. But before we get to that, in your brain you also have something called the pituitary gland. Now we've been talking about this in previous lectures when we talked about acromegaly, thyroid issues. Okay, so in your brain you have the pituitary gland. Now the pituitary gland is going to secrete ACTH, adrenocorticotropic hormone. ACTH is going to be released and it's going to come down here. It's going to tell your adrenal cortex, your adrenal gland, to produce three different things. So number one, your adrenal gland can produce, number one, the glucocorticoids. Okay. Now the glucocorticoids, these secrete cortisol. Now cortisol regulates your metabolism. So make sure you know that it regulates your metabolism. And number two, cortisol also increases your blood glucose levels. Now getting used to knowing one problem and knowing what that one problem can cause later on. So with this right here, with this increased blood glucose levels, this can make your patient show symptoms of diabetes. So with these patients, if you get this type of patient, you're going to have to monitor their blood glucose levels. You're going to have to do finger sticks. You may have to change their diet, put them on the diabetic diet. Okay? So that's thinking many, many, many steps ahead. So again, it's going to produce the adrenal cortex. Your adrenal gland is going to produce, number one, glucocorticoids. Glucocorticoids are going to secrete cortisol. Cortisol regulates metabolism, and it also increases your blood glucose levels. Number two, your adrenal glands also produce mineralocorticoids. The main one that you need to know is aldosterone. Now remember that aldosterone makes your kidneys, your kidneys retain sodium. If you retain sodium, you're also going to retain water. If you retain sodium and water, this is going to increase your blood pressure. You're also going to have increased weight because of the water. Okay? So boom, right there, increased blood pressure, increased weight. Now the other thing that it's going to do is it's going to, remember, sodium and potassium have an inverse relationship. If sodium goes up, potassium must come down. Therefore, you will be hypokalemic, or your potassium levels will drop. You will begin to excrete or get rid of potassium through urine. So again, you will become hypokalemic. If you become hypokalemic, you worry about cardiac issues. So for these patients, you'd want to probably put them on some type of telemetry or get an EKG if they become extremely hypokalemic. Number three, the other thing that the adrenal glands will produce are the androgens, your sex hormones. Now these will affect men and women in different ways. In men, they will cause gynecomastia, or increased breast size. In women, it will cause hirsutism, or an increase in facial hair, an increase in chest hair. Okay, make sure you know both of these for your NCLEX exam. So again, that's really, really brief, really, really quick. A little bit of physiology. Now let's get into some Cushing's causes. The number one cause for Cushing's, let me get my camera focused here. The number one cause is some type of medication. Maybe this patient has some type of rheumatoid arthritis, some type of arthritis. They go to the doctor prescribes something like prednisone, something like hydrocortisone, solumedrol. Okay, again, these are all steroids. Now, the purpose of these steroids are to decrease inflammation. They have an anti-inflammatory property. So again, that is the number one cause. It is an exogenous form, i.e. medication. Number two, if it is not because they are taking some kind of medication, about 85% of the time it is due to a pituitary tumor. Now, I think that makes a lot of sense if you understand that, for example, the pituitary gland secretes ACTH, and we just talked about how ACTH is going to come down until your adrenal gland to secrete all of these three things. Okay, so in 85% of the cases, when they are not taking medication, it is due to a pituitary tumor. Number three. This can also be due to an adrenal tumor. Maybe you just have an increase in adrenal gland size. Number four, some type of ectopic tumor. Now, this could be something like a pancreatic tumor or a tumor in the lungs. Now, this typically indicates some form of metastasis. Now let's get into some signs and symptoms or clinical manifestations. What will your patient show? So number one, we talked about this a little bit. You have weight gain. Remember, that's going to be due to that increased sodium and water retention. But the other thing that you're also going to have is increased fat and increased adipose. In three very distinct places. One, in the face. You'll get that moon-shaped face appearance. Number two, you'll get in the trunk or in the abdomen. So these will have very, very large abdomens. Now, the interesting thing here is it will have striae. More specifically, red or purple striae, or stretch marks. So upon physical examination, you will find multiple red and purplish stretch marks in the abdomen. Number three, you're also going to find fat or adipose in the cervical region or in the neck region, in the back of the neck. And they'll get that buffalo hump appearance. So make sure you know these, because these are very, very distinct things that you'll find on Cushing's. Now, we talked about this briefly a little bit ago. You're going to have hyperglycemia. Do you remember why? If not, rewind and replay. So with these patients, later on, again, you're going to have to do finger sticks. You have to monitor those glucose levels. 4, cortisol has a catabolic effect on protein. Again, cortisol has a catabolic effect on protein. Catabolic effect just means that cortisol is going to break down protein. It's going to eat protein away. Therefore, you will have protein wasting. And as a result, you'll have weak muscles. Remember, muscles are made out of protein. Cortisol will also have an effect on bones. So these patients will also, long term, will suffer from osteoporosis. The cortisol will also eat away the bone structure and again causing osteoporosis. Now we just talked about how protein has cortisol has a catabolic effect on protein. Well, you also have protein in your skin. So these patients will have very thin skin. Okay? And it will be weak. And therefore, these patients easily bruise. So when you do your physical examination, check for multiple bruising or multiple bruises throughout the body. Now, the other thing, we talked about in the beginning how cortisol, the corticosteroids have an anti-inflammatory effect. They decrease inflammation. Well, the other thing that they do is they decrease your immune system, or they suppress your immune system. So maybe the patient has some type of autoimmune disorder. So what the physician may prescribe may be a steroid therapy. Again, steroids suppress your immune system. And in a person with an autoimmune disease, well, you want to suppress that immune system. Okay? But one thing they have to be aware of is that if their immune system is suppressed, these patients have a higher risk of infection